Zoom, and we're now in public session. I'd like to welcome you all. So from St Vincent de Paul, I'd like to welcome Dr. Tricia Keelty, Head of Social Justice and Policy. And I'd also like to welcome from NCBI, Chris White and Darren Reid, who's a service user. You're all very welcome here today. In a moment, I'll ask Dr. Keelty to make her presentation, and then followed by Mr. White. However, before that, I'd like to and then members can ask questions. I understand Deputy O'Dea is at another meeting. He was here earlier. He hopes to be back, and one or two others are in the Shannon Dála as we speak. I wish to draw your attention to the fact that by virtue of Section 17(2)(l) of the Defamation Act 2009, witnesses are protected by absolute privilege in respect of their evidence to the committee. However, if you're directed by the committee to cease giving evidence in relation to a particular matter, and you continue to so do, you're entitled thereafter only to a qualified privilege in respect of your evidence. You're directed that only evidence connected with the subject matter of these proceedings is to be given, and you're asked to respect the parliamentary practice to the effect that, where possible, you should not criticise nor make charges against any person, persons or entity by name or in such a way as to make him, her or it identifiable. And members are reminded of the long-standing parliamentary practice to the effect that they should not comment on or criticise or make charges against a person outside the House or an official, either by name or in such a way as to make him or her identifiable. Once again, colleagues, before we commence, if you have mobile phones, you might turn them off or to flight mode. Apart from interfering with the meeting, they interfere with the transmission and the recording. So you're all very welcome. Dr. Keelty, maybe you'll start, if you don't mind. We've received the written submission, so if you'd like to do your presentation, and then we go to Mr. White.
Thank you, Chair. The Society of St Vincent de Paul welcomes the opportunity to present our Budget 2020 proposals to the Joint Committee on Employment Affairs and Social Protection. To give some context to the proposals that we put forward today, our members see the daily struggle to make ends meet in households where there's simply not enough income to meet outgoings. It's when this struggle becomes overwhelming that families often request our help for the first time. Last year we published a report which was carried out by the Vincentian Partnership for Social Justice and looked at the experience of families who could not afford a minimum essential standard of living. Research participants had an income between 3% and 39% below what was required to meet their basic needs. Half of the participants in the research were in employment and did not have an adequate income despite this. The parents who took part in the study worked very hard at budgeting and prioritising expenditure and tried to protect their children from the effects of poverty and low income. However, the experience of going without characterised daily life, and parents were constantly saying no to their children, leaving them feeling guilty and ashamed. The research showed that living on an inadequate income is very stressful and emotionally draining and can have a major impact on physical and mental health. The longer it goes on, the more difficult it is for families to see a way out. SVP strongly believe that people who receive social welfare should have the means to remain integrated and participate in society. The danger of inadequate social welfare is that it can trap people in poverty and lead to greater social health and economic costs in the future. Adequate social welfare helps people reconnect to the world of work and allows them to live in dignity. So therefore, first and foremost, we are asking that social welfare rates are set at a level which is grounded in evidence and that is sufficient to lift people out of poverty and provide them with a minimum essential standard of living. We are aware that reaching this goal would require action over a number of budgets, and in the context of Budget 2020, choices will have to be made in the context of a potential no-deal Brexit. So it will be crucial to focus increases in payments for those experiencing the deepest level of inadequacy, namely households headed by one parent, single working age adults, including those under the age of 26, people with disabilities and households with older children. The issue of in-work poverty is a growing concern for SVP. In 2019, we published a report entitled Working, Parenting and Struggling. The analysis of the employment and living conditions of one-parent families in Ireland found that the living standards of lone parents are among the worst in Europe, and that the rate of in-work poverty among these families more than doubled between 2012 and 2017. To reverse this upward trend in in-work poverty, Budget 2020 should seek to increase the earning disregard for lone parent payments to €166 to restore the value to 2010 in terms of hours worked at the national minimum wage. We're also asking that the hours requirement for the working family payment is reduced from to 15 hours from 19 in recognition of the greater difficulties lone parents face meeting this threshold alone. Although not directly within the remit of this committee, SVP are concerned that a significant proportion of the poorest lone parents will lose out on the new national childcare scheme. The average weekly cost of school-aged childcare is €145. However, the maximum subsidy a lone parent will get under the NCS is €45 per week for 12 hours when their child turns 7. This is the same time that they're also subject to labour activation measures. We believe that a lack of sufficient childcare hours will undo any potential Budget 2020 measures introduced by the Minister for Employment Affairs and Social Protection aimed at reducing inward poverty among lone parents. Therefore, further investment in the targeted aspects of the National Childcare Scheme is required in Budget 2020 to ensure the poorest families do not lose out. In terms of energy poverty, SVP are concerned that energy affordability persists without accounting for any potential increases in carbon taxes. The combination of increased energy prices, poor quality housing and the persistence of low income impacts on households SVP assists. At current levels, fuel allowance is insufficient to meet the cost of energy for people on low incomes. A weekly additional week of fuel allowance was introduced in Budget 2019. This brought the payment to €630 for the winter months. However, to restore the payment to 2010 levels in real terms, it should be increased to €830. Increasing the living alone allowance by €3 can also provide additional protection to older people who are more vulnerable to energy poverty. Last month, SVP received over 200 calls per day from worried parents struggling with education costs. In our submission to the Minister for Education, we are asking for investment to provide all children with free school books at primary level and an end to the practice of voluntary contributions. To help alleviate some of the pressure on families, we are also asking that child benefit is made payable to all children until the end of secondary school, regardless of age. The Exceptional Needs Payment is a critical scheme for low-income households and is often the scheme of last resort for people in difficult circumstances. However, delays and difficulties in accessing services create unnecessary stress and strain on people when they are vulnerable. It is critical that frontline Department of Social Protection services are adequately funded and that the total budget available for EMPs is increased by €11 million to meet unexpected costs faced by low-income individuals and families. So to conclude, Budget 2020 must reflect a real commitment to tackling poverty and deliver on the goal of a fairer, more inclusive society. This will require a genuine whole-of-government approach to budgetary decisions and assessing all public expenditure against its impact on poverty. When prioritising resources, decisions should be equitable, fair, just, protect the vulnerable, address structural inequalities and promote the well-being of this and future generations. Thank you.
Thank you very much for your opening statement. Now from the NCBI, Mr. White and Mr. Reid, if you feel you want to join in, feel free to comment as well. So I think, Mr. White, you're opening.
That's right.
But Mr.
Yes.
Reid, you're more than welcome to comment.
And Mr. Reid will be finishing, so he'll be closing and I'll be opening. So the NCBI are grateful to the Chair and the Joint Committee on Employment Affairs and Social Protection for the opportunity to present to you here today about the issues around employment and social welfare needs for those people who are blind or vision impaired. The NCBI, the National Council for the Blind of Ireland, is Ireland's national charity working for the rising number of people affected by sight loss. At NCBI, we're working every day with people of all ages, from young children to those reaching their 100th birthday. The majority of people we work with have some remaining vision, while only a small percentage are completely blind. Census 2016 figures show that there are currently 54,810 people with sight loss living in Ireland today, and that number is rising, and anecdotally we would suggest that it's underrepresenting the actual number of people with sight loss in the country. One of our major concerns is around employment and the employment rate. The Census 2016 found the level of labour force participation amongst people who are blind or vision impaired in Ireland is at only 24.4%. So that means of the 24,000 working age adults in Ireland, only 5,856 are in employment. Unfortunately, this compares poorly internationally, where we look at the employment rate in the UK is at 27%, 38% in Canada and 42% in Australia. This makes the people who are blind or vision impaired in Ireland as being one of the most marginalised communities in the country and our society, and one which is not identified or spoken about in any meaningful way. In an economy that claims to have near full employment and employers actively undertaking expensive international recruitment drives to attract talent and the whole talent conversation, it means employers, both private and public, are consistently overlooking and not utilising or capturing the skills of people with disabilities here in Ireland. Not only is this a missed opportunity, but it also demonstrates significant inaction towards making the national workforce more inclusive. Yet we know from users of the NCBI Employment Service that once given the opportunity to work, people who are blind or visually impaired demonstrate real competency and loyalty to their employer. And again, anecdotally, the retention rate is far higher among employees with sight loss once they are recruited than those without disability. A key component of making the workplace more attractive and getting more people with sight loss into employment is the Workplace Adaptation Grant, and that's a contribution by the state of up to €6,350. And it can also be used to upgrade adaptive equipment, which may have been previously funded. Applications in excess of this sum will be considered on an individual basis up to a maximum of €9,523 if specialist training for assistive technology is required. The total amount of money allocated in 2018 was €87,000, which resulted in only 39 applications. If the state were to increase the allocation from €87,000 to €2 million in 2020, this would result in at least 314 people accessing the grant and taking up employment. The cost of the exchequer of keeping those people currently unemployed and on various forms of welfare payments is €3,314,000 a year. So taking these people from a benefit trap and putting them into work has a minimum net gain to the exchequer of €1.3 million without considering any additional taxation that would accrue from their participation in the workforce. So our asks around employment is really to value the disability community and the people with sight loss that actually are being excluded from the workplace, a contribution of €2 million to the Workplace Adaptation Grant, which would actually pay for itself in kind. The Workplace Adaptation Grant should be administered consistently across the country. Various different departments and various different local branch offices have different interpretations of what the administration means. It needs to be extended to include the not-for-profit organisations who currently cannot avail of the grants and are expected to provide the required adaptations from their existing inadequate funding. And the department needs to fund a national awareness campaign that proactively promotes the Employee Retention Grant Scheme and Workplace Adaptation Grant Scheme targeted at employers who are largely ignorant of the supports that are available to them to encourage them to recruit people with sight loss and other disabilities. In keeping with that, the free travel scheme is something that is valued by all those who can avail of it and needs to be retained. However, not all people with sight loss are eligible for the free travel scheme. Many people with sight loss who are not able to obtain a driver's licence but do not qualify for the free travel scheme. There is an alarming 700 people using our services who have no other option but to pay for each journey on public transport to school, college, work or leisure activities, as they do not have sufficient vision to drive a car but are not eligible for the free travel scheme. Access to free travel is not a luxury in this case for this specific cohort of people. The per capita cost for the free travel scheme, according to the Minister for Employment Affairs and Social Protection in February 2019, was €101 per person. Adding an additional 700 people with sight loss would cost the state an additional €70,700. Our ask would be that the eligibility criteria, therefore, for the free travel scheme would be extended to include those with long-term eye conditions, which renders their vision insufficient to meet the criteria for a driving licence. If I can give an example of a personal story of Des Keeney. Des lives in County Leitrim. He is one of 700 people who cannot drive but is not blind enough, in inverted commas, to be entitled to a free travel pass from the Department of Employment Affairs and Social Protection. Des has worked his entire life and is now retired. He has to depend on his wife to drive him wherever he wants to go, as he has to pay the full price for each journey he takes on public transport. Access to free travel would give Des independence to take the journeys more public transport, bring him where he needs to go, rather than relying on others to drive him. Finally, in terms of community employment schemes, the level of labour force participation amongst people who are blind and visually impaired, as we've said, is only 24.4%, and therefore community employment schemes represent an excellent opportunity to actually get back into the workforce for blind and vision impaired people. Our ask would be that the Department would extend the workplace adaptation grant to those on social activation schemes, such as community employment, TUIS and other schemes, and that people who are blind or vision impaired should be allowed to apply for a second social activation scheme so that they can get experience with another employer. Again, giving a personal story, in 2015, David Corcoran got in touch with NCBI. He had worked his whole life and wanted to get back to employment after he experienced reduction of his sight as a result of glaucoma. He availed of NCBI's employment services, orientation, and our technology service. In 2019, David was given the chance to take up a position in a CE scheme. In order to take up that role, David needed magnification software to enlarge everything on his computer screen. However, as the organisation offering him a job was a charity, a Section 39 organisation, his employer could not apply for the Workplace Adaptation Scheme grant, and the Department of Employment and Social Protection was unwilling to allow that application to go forward. This meant that he could not have the funding that he needed to get into the technology, which would enable him to have work experience and get back into the world of work. Finally, echoing our colleagues in the SVP, research has been carried out by the Vincentian Partnership for Social Justice and the NCBI that found the minimum essential standard of living for a single adult with vision impairment costs 18% more, or €44, on a weekly basis than for a single adult in the main population. So we would call on social welfare over time to commit to an incremental increase in the basic social welfare rate for the blind pension and disability allowance ahead of inflation to address the additional costs of living with sight loss. And in terms of living with sight loss, I'd just like to ask Darren to give a few views on his employment experience.
Thank you for the opportunity to talk. I've been out of employment for 10 years now, ever since I actually graduated from college. I'm a qualified social care worker, but I've never actually been able to get a position in that field. I've tried getting work in other fields, and at every turn it's been, we do not have the capacity to offer you employment right now. Either it's been, I'm not qualified enough, or the technology isn't there. And whenever I try to tell them about it, it's a matter of, well, we can't afford to get that technology. On one occasion, it was a matter of, the technology does not exist. And I said, it absolutely does. They would not do the work to find it. And I tried to go about this. It was just, there was no way to do it. They weren't aware of any avenue they could go down. Recently, I've been lucky enough now to actually be offered a position in the civil service. I had to go through 2 years of competition to do that. It's not the avenue that I wanted to go down, but it's a job that I'm now able to do and I'm willing to do because I want to work and I want to actually contribute to society. But since I've been offered that position, I'm still now 7 months waiting to start that because I'm waiting on clearance. And even now, when I will be given a start date, I'll have to wait even longer still for them to actually get technology into position. It's not an ideal thing. Employers need to be aware of what is available for them to do. And the government needs to just get the word out. It's not acceptable what has been done so far. We want to work. There are 75% of us that aren't. And we're sitting around wasting your money, not ours. I'm in a very fortunate situation that I get to live at home with my parents. And I don't want to do that. I want to be out. I want to be on my own, but I can't. Please just sort this out. You have the opportunity to do it.
Thank you, Mr. Reid.
Thank you very
much. Do you mind if I ask you a question, just so as I understand? I'm sorry, I'm Senator Higgins, but specifically, Mr. Reid, on a couple of you had looked for previous employment before the civil service, and you mentioned, employers weren't prepared. There was technology, and they didn't know. Was it they didn't understand the technology that was available, or they didn't understand the workplace grant, or was it both?
Both. They didn't understand that the grants were there and available to them to use. They didn't understand the technology was there to be used. In one case, they said the technology that was available was incompatible with their system, and they were not willing to source the alternatives that would work.
Okay. So despite the fact that, and I take it because you're familiar with the technology, you were telling them what was available.
Yes.
And they didn't engage.
Yep.
Okay. Thank you, Mr. Reid. Senator Higgins.
I'd like to thank all the presenters, and there's a number of interesting points. I might go first back to NCBI, and then I have a number of questions for Vincent de Paul. As you described it, in relation to, I will say I was quite shocked at the low allocation to the Workplace Adaptation Grant. You may be aware, Mr. White and Mr. Reid, that we had a joint hearing, a joint sitting of this committee, where we met with the Education Committee, with the Health Committee and the Search, where we had a joint, where we talked about the obstacles for persons with a disability in terms of accessing employment. And the Workplace Adaptation Grant was spoken about, and when the department spoke, they talked about the Workplace Adaptation Grant. So the scale, I will say, I'm quite shocked that it's so low. Can you tell me then, is it the case that there is a large number of refusals from your experience? So are you saying that there's a set amount, 87,000, and that effectively, once that has been spent, all future further applications for workplace adaptation grants are refused? Is that the case?
Yeah, Senator, that would be the case. And what you get is outright refusal or outright turning down when you say, well, the organisation that you're in, if it's not-for-profit, doesn't qualify.
And I think that in terms of the exclusion of not-for-profits, aside from being discriminatory towards not-for-profits, also for individuals such as Mr. Reid, if you want to work in social care, if the areas in which you want to find employment and contribute are areas in the not-for-profit sector, it seems extraordinary that they're effectively...
They would be locked out.
You're locked out of your choice in how you wish to contribute and how you wish to employ, to work. Does the application normally is it normally from the employer or the potential employer, or does it come from the individual? And I'm just wondering, for example, if I'm an individual and I wish to go to 3 or 4 or 5 companies in a particular area and apply around potential employment, is there anything that would allow me to say, I have got sanctioned for a workplace adaptation grant, and that's something that I bring with me, and or does it require a potential employer to put the application process through and so forth?
Senator, you're right. It's actually led by the employer. It's an employer-applied grant that you have. So the employer, the House of the Oireachtas, would actually have to make the grant.
And that employer would have to apply in respect of a particular individual. You couldn't have an employer who says, I want to make my workplace, available. So you basically mean the way that it's done as well at the moment, which I imagine adds pressure, is that it's only if an employer advertises for somebody and they want somebody usually to start probably within a month or 2 months, that effectively a delay is put in place, and that makes it difficult for the applicant and creates a reluctance. So I just wanted to have a sense of how it teased out, because I think
you're 100% right on that.
Okay. Well, I just want to say, I will take this concern on board. I think it's an extraordinarily low allocation for something that I've certainly heard trumpeted as being a wonderful solution that's available to persons and to organisations.
Can I ask one supplementary on that? You specifically, sorry for interrupting you, Senator Higgins.
No, go ahead, I think.
So as I don't come back to it, you put a figure of 2 million on what you required. What is that 2 million based on? In other words, you must have some measure of the scale of refusal, or...
The figure is based on our extrapolation of demand and it is basically from a sight loss perspective, but we're acutely aware that there is more than sight loss as a disability. So we're saying, as a starting point, from the, as Senator Higgins says, the very low level of support for workplace adaptations, as a starting point, getting up to 2 million would be a reasonable uplift to where it needs to go. It probably needs to go to multiples of that, Chair. But at this moment, I don't think with pressure on budgets, I think that's not an unreasonable point, certainly because it would pay for itself within 12 months. And any investment in that should pay for itself
because
within the period.
Are going back. Yeah, no, I get the...
But I didn't want to come in here and say it should be 45 million.
No.
To be honest, which it probably needs to
But
be
I
around that.
suppose the question I'm asking you specifically, Mr. White, is you've seen enough people apply for a grant that was now spent in the first couple of months of the year. That type of.
Yeah, so our experience would be with that 2 million figure is based on the experience that we have of the number of people that are looking for it, and if everybody got the maximum amount, the maximum sum available for them through our service, it would be 2 million.
Okay, thank you. Sorry, Senator Higgins.
Just a final on this, because I think it's worth teasing out, and it relates to, as I said, an issue that this committee has given a strong focus to before. My colleague in the Civil Engagement Group, Senator John Dolan, as you will be aware, is with the Disability Federation Ireland, and there's a long overlap here. Just a suggestion, something that would be really useful for us as we push and make the case for this is if we had a sense of, if there is some monitoring of persons who are informing you, even if it's informal, the numbers that, if we were able to say, we know that there are 50 cases or 100 cases who have potential employment and who were refused effectively that employment. And the other, which is, I think, is, as you put it, Chair, if the grant is gone by February, I think that that's something that we need to be marking politically, the fact that the opportunity to work has effectively been denied to persons with a disability seeking workplace adaptation grant for the entire rest of the year. As somebody's talked about, the gender pay gap, and we have that point in the year at which that disparity comes in place. I think it's similarly, and the last suggestion, I think perhaps, Chair, we might, I don't know how we will, in our estimates hearing, be looking at the gender inequality proofing, which is a requirement now of the department in relation to the social protection budget, indeed of all departments. And I think this seems to me that an issue that we certainly would wish to raise in terms of inequality proofing for the Department of Employment and Social Affairs, in terms of a differential offer that is being made. And just to mention, I know we haven't spoken on your other points, but thank you very much for them. And I think at the point in relation to the blind pension and so forth is well made and taken as well. And the question around expansion of free travel. I mean, I hope we move towards a blanket free travel. I think we need to move for other imperatives, including the energy imperatives, towards a much wider access and promotion of free public transport. But I think that this is yet another case where that's important.
Well, Senator, it's interesting that only 6% of people with disabilities actually use public transport.
Yeah.
So when you look at the issues around sustainability and around access, people with disabilities generally are unable to take up the opportunities around public transport because they're not able to use it effectively because the transport system is not user-friendly for people with disabilities.
Yeah. Okay. Thank you very much. And in terms of for Vincent de Paul, so thank you very much, and thank you. And I read your submission in relation to the budget as well, your longer submission, with great interest. I think there's a number of really strong proposals in it. A couple of one I wanted to note is I was very glad to see you put a focus on private rental, and particularly private rental dependent on either rent allowance or HAP, because I think that there's a huge vulnerability there. I know that you mentioned a couple of issues in relation to that, specifically in terms of the energy poverty issue, and this is a key concern that I would have is in relation to the persons who may be in private rental are in private rental dependent on state support in relation to their private rental payments. So again, clearly in an economically vulnerable context, are not necessarily in a position to minimise their energy bills because the power and control in relation to that lives with the landlords. And you identify there is, and this is a concern, that the need to ensure that landlords bring buildings up to standards so that the cost of heating those buildings is not disproportionate and is not, and it will increase, as we know, as the price of carbon increases. But how we do that in a way that ensures rental security. And it's something that I've teased out before, and I've tried to put in amendments in relation to it around, but in terms of Part 4 tenants, for example, do you think that there's something in relation to that relates to the question of where homes are being retrofitted for energy security purposes, that should not be regarded as, say, refurbishment in the way that we see refurbishment often used as a rationale for the ending of secure tenancies and the ending of Part 4 tenancies. And I know that that is a genuine, I've spoken to many people who are in situations whereby they are afraid to raise concerns in relation to their property or the house that they are renting, because they know that if a refurbishment was to be underway, they would lose their tenancy. And you kind of have a trap in that sense. And that's just one issue I was interested in relation to that, because I think you identify that danger even in the way you've written it. And I just wanted to tease it out a little bit more and think of an example of how we can build that security in while ensuring the energy poverty, which combines the others. And it is, I think, very notable. If energy poverty is, in the debates we were in yesterday, is determined as being, or fuel poverty is, where fuel is 10% of your income, but that private renters at 40% of their income in many cases is going in simply on having a roof over their heads. I was also interested in the focus on lone parents and the income disregards. We know the income disregards were very substantially cut back in 2012. They've been incrementally restored, I would say not increased but restored, but not fully restored. So in terms of your measure, how close would that bring us to have in a full restoration? And another concern that I have is specifically in terms of, and your research on minimum essential standards of living points to that, the huge costs associated with older teenagers, and the job seeker transitional payment at the moment terminates when a child is 14. So one parent family payment terminates when a child is 7. The job seeker transitional ends when a child is 14. And it is a concern that at that point, between 14 and 18, for lone parents, effectively they lose the benefits of job seekers transitional, and that means they also lose, I believe I'm correct, income disregard. So do you think it's also important, as well as increasing income disregard, that we would increase the level of job seeker transitional to ensure that that income disregard continues until a child reaches at a minimum 18 or leaving school age, which is the case you make, I think, elsewhere in the document. So maybe just on those 2 points first, if you would.
Yeah, you're absolutely correct in terms of the challenge in ensuring that the private rented sector has minimum energy efficiency standards. There's a huge challenge in terms of the split incentive, in that landlords are unlikely to upgrade the homes because they don't see an initial benefit to them, and tenants, if they're low income, don't have the means to do that. A lot of the schemes that are available from the Department of Communications, Climate Action and Environment are only available to low income households who are homeowners. So at the moment there's no schemes available for people who are privately renting. The take up by landlords of the Better Energy Home scheme is less than 3%. So there's not enough incentives there in terms of how you actually encourage landlords to upgrade their properties without having a negative impact on the supply of rental properties or on rents, so that rents aren't increased because a landlord see that I've made this investment and they maybe want to increase the rents as well. So while there is challenges, there's a huge opportunity there to actually, if the measures are properly designed, so if you have incentives for landlords that are conditional on security of tenure. So if a landlord is willing to rent their property to a HAP tenant for a long tenancy for 5 or 10 years, that they can access grants then to upgrade the home as well. That's something that we've put forward. This would require a long lead-in time, and I think we have suggested that by 2030 all private rented accommodation would have a C BER rating or above. So that's obviously a long-term ask in terms of that, and it would require incremental changes over a number of years to actually reach that. The other one is the state is the landlord of approximately 140,000 households. So that's a very straightforward way of actually upgrading the stock of housing. Social tenants are more at risk of being in energy efficiency homes, as are people in the private rented sector. So there are 2 areas that need to be looked at in terms of the Climate Action Plan, and also in terms of how we tackle energy poverty, because it's a really important area, particularly if carbon taxes are increased.
And just before we go to the lone parents issue, but I totally agree with you in terms of, from my perspective, I mean, every property that the state in fact owns. The idea of doing that incrementally seems to me foolish, in that we pay for it in our carbon fines and so forth. So it would seem that the scale of refurbishment of local authority housing seems to be extraordinarily slow.
Yeah.
It's not something that should be a 10-year plan, but it really should be something should be over the next 2 to 3 years. We should look at all stock. So, and then just in terms of the other issue, so is it really in sense what you're proposing, or perhaps if not proposing, what you're outlining as a possibility, is almost a carrot and stick approach, whereby there is an incentive for those who give long-term tenancy security, and there is a stick effectively, in that at a certain point, if private rental properties, the ownership of a private rental property that is below a certain energy rating may be something that needs to be marked or noted or penalised, or in some ways.
Yeah, I suppose.
And then, you know, if people don't want to give the long-term tenancy, they have the choice to, of course, privately reach that standard.
Yes, of course. So
Yes.
it might be a gradual phasing out of F and G rated properties, like, so that you'd have to upgrade those in the first instance before you actually reaching a C grade is quite a big leap. Yeah, for a lot of rental properties. But those shallower measures like attic insulation, cavity wall installation, they can help in some ways, and they're not as costly as maybe deeper retrofits. But the deeper retrofits definitely something that should be prioritised for local authority housing as well.
Thank you. And then in relation to the
yes,
lone parents.
the lone parents issue, obviously this is a real issue of concern, considering that Silk data shows that in-work poverty among this group is increasing. I suppose Silk is only up until 2017, and there's been some incremental improvements in the last 2 budgets in terms of supports for lone parents who are at work on doing some of those cuts that were implemented over the austerity years. So we should see an improvement. Well, we'd hope to see an improvement in those figures once the new poverty data is released towards the end of the year. But in terms of the earning disregard, so in budget 2019, that was increased to €150. So that was in nominal terms higher than it was before it was cut, but in real terms, in terms of how many hours worked at national minimum wage, it's below that. So it needs to be increased to €166 per week to reflect increases in the national minimum wage, so that the same hours can be disregarded as they were in 2010. In terms of the job seekers transition payment and the job seekers allowance, you're 100% correct. So there's a very complex system that a lone parent needs to navigate if they're working part-time. So if you're working part-time on the national minimum wage, when your child reaches the age of 7, you have to choose between either keeping the working family payment or using the earning disregard attached to the job seekers transition payment. So either of those options are going to leave you about €80 less every week. So that issue has to be looked at, and we have recommended that the working family payment is made payable with the job seekers transition payment, so people aren't losing out at that transition phase. And then when the youngest child reaches the age of 14, they have to either the earning disregard changes, so you can spread your hours over the 5 days, but if you're on job seekers allowance, you can only have your hours worked in terms of 3 days a week, and then it's different, so you're going to lose out then, and the earning disregard is a lot lower as well. Yeah. So we would agree, and we have it in our proposal, that the job seekers transition period should be extended out until your youngest child is 18. So that's a real critical point where supports can be implemented to actually, particularly those who are furthest from the labour market, to invest in training, education supports, so that they can make that transition once their youngest is 18 to sustainable employment. Decent work is really important as well. On the issue of the older teenager, last year was the first time the state recognised the additional costs faced by parents who have older children, in that their qualified child increase for children over 12 was introduced, and that was based largely on the work of the Vincentian Partnership for Social Justice, which showed that the cost of a teenager is significantly higher than younger children as well. So that, at the moment, there is a mechanism there. It's still a lot further than it needs to be in terms of the total cost of raising a teenager, so that would need to be increased as well in terms of the budget.
Okay, thank you very much. And I have a last point, and then I pass to the chair, who I know will want to ask. Just one comment. I would concur in relation to the income adequacy issue. We've forward to have the word adequacy included actually in the Low Pay Commission's terms and conditions, which it wasn't, and I regret that, because that is the fundamental test of pay. But the 15 hours, 19 hours in relation to qualifying for the working family payment, a rationale that I think is a strong one in relation to that, but I'm just wondering if you would concur around that, is the fact that the childcare provision under, say, the ECI scheme and so forth is 15 hours at the moment. So for that 15-hour to 19-hour gap, whereby people may have 15 hours of free of early years care and education, but they're required to be working 19 hours in order to qualify for the working family payment. Just if you had any kind of comments on that disjoint, and I know that it doesn't just necessarily affect parents, it also affects people working in early childhood care and education who may be working a 15 or 16-hour week, but would themselves need to qualify for, have 19 hours to qualify for the working family payment.
Yeah, and I suppose this is one area where it's really important to have joined up thinking, because as I outlined in the opening statement, the National Childcare Scheme is going to see the poorest lone parents lose out if it's implemented as it's intended to. So if there is a gap there in terms of the childcare subsidy, any positive increases in terms of employment supports could potentially be undone if the subsidies aren't responsive to the needs that lone parents have in terms of those issues. Just on the adequacy piece, I suppose it's important to say there's been a lot of discussion about indexing social welfare, and there's a lot of options, and one, for example, is indexing to the Consumer Price Index, and the other is indexing to wages. But what we would say is that at the moment the majority of social welfare payments are below what is adequate to meet a minimum essential standard of living. So if people are living below that standard and you index without reaching an adequacy benchmark, you're essentially going to copper fast in poverty, in that the increases will be based on an inadequate income. So it needs to reach that benchmark, and then you can index from that point. That's important to say.
Thank you.
Higgins, I'll come to you in one moment, Senator Conway. Just, Dr. Keelty, one or 2 points of clarification. The issue in relation to the working family payment, the 19 to 15 hours, was that proposal specifically for lone parents, or was it across the board?
We would see if you could implement it for lone parents, if there's budgetary constraints, that would be because targeted aspect of it, because lone parents have to reach the 19 hours alone, where a couple can reach that threshold together. And we'd also say there's a similar issue in terms of the thresholds for the back to school clothing and footwear allowance. The threshold for a one-parent family is much lower than a two-parent family. So if you equalise those, it would allow more lone parents to access the back to school clothing and footwear allowance. We don't really understand why there's two different thresholds for that, because the costs are the same for parents regardless if there's one or two parents in the household.
So the lone parent or the couple, in terms of that allowance, to equalise it?
Yes, yes.
Okay. And when you spoke about in-work poverty, it was primarily in relation to lone parents. But in-work poverty in general, had you any further comments to make in that area?
Well, I suppose there's 100,000 people who are working and not have below the poverty line. I suppose, and we would be a strong advocate of the living wage, and we've made submissions to the Low Pay Commission on that issue. We need to increase our national minimum wage, so it bridges the gap with the living wage, but it's also about ensuring that the costs of living are low for people as well. So that's that whole of government approach in terms of housing costs as well, so that people who are working have a decent standard of living as well.
I was just taken with one comment. I suppose I went off at a tangent, but you were talking about in relation to the lone parent payment of 166. You were talking about to restore to the 2010, and you were making reference to the fact of the minimum wage, the number of hours worked. And I suppose one of the challenges and one of the key things to keep an eye on a social welfare budget is that when you give somebody an increase in terms of whatever that allowance might be, that there isn't an unintended consequence that they miss something else. So, for example, they miss the threshold for a medical card or something like that. And it's important that that type of proofing goes into a budget as well. It becomes
Absolutely agree, and that's something that we've been making in our interactions with the Department of Social Protection. For example, last year the national minimum wage went up, but the thresholds for the working family payment didn't increase. So you're not maximising the benefit of that increase for people. Yeah. So it needs to automatically
Yeah,
go.
no, it struck me in relation to that, but right across the board where you're giving an increase, that the thresholds and bands and margins must be aligned to give full effect of the increase.
Yes, absolutely.
And there aren't unintended, that you all of a sudden, as I say, with the medical card, you qualified last year, but you get a €5 increase and you're over a threshold or whatever it might be. Mr. White, I just want to ask you one question, and Senator Conway, I'll come to you. You mentioned, and I was taken with it, and I suppose I never really understood it. You said that there were 700 people who cannot drive. Your words were they weren't blind enough to drive, and they don't qualify. What is the threshold at the moment to qualify?
The threshold for losing your driving licence?
No, to qualify
for free travel.
Yeah, for free travel.
I don't have the figures. I don't have the details with me, Chair. But I mean, it's a discretionary. My understanding is it's a discretionary. You have to be assessed on your individual needs. And the fact that you have been debarred from driving because of your vision isn't sufficient in its own right.
No, I was unaware of that. I just wanted to clarify it, that you can be. A doctor can certify that you are not fit and not competent to drive because of your visibility and vision, and yet you don't qualify for.
That's correct.
Okay, thank you. Senator Conway. You're very welcome.
It's great to be in your committee. I think it's my first time in your committee since you took over as chair, and I believe from colleagues that you do a very, very good job. And I'm delighted to just sit in on this, and apologies, I'm very, very late. We had a housing committee where I was the lead speaker and I couldn't leave it, but I did become aware that you had guests in that I would have liked to have heard their opening statements, but I would be very, very familiar with, I'd say, a lot of the content of certainly Chris White, and Chris is very welcome here, as is Dr. Keelty and Darren. And just to pick up on the point that you mentioned there, Chairman, I have discussed this with Minister Doherty on a couple of occasions. I think that part of the problem is that you have to be permanently certified as not being capable of driving for life as such. And I think there's some sort of discrepancies there that I believe are being looked at. I think it's something that's frightfully unfair, and that even if somebody isn't in a position to drive because of their eyesight, well then they should be issued with a time-dated travel pass. So maybe in 5 years' time then, that if whatever treatment they may be going for will render their sight possibly suitable for driving, that the pass then would become void or whatever. There has to be a way around the whole permanency thing. Overall, I think the big issue that I have in terms of social protection, and is something that I think we need to start looking at, and that is where the welfare system prevents people from having the motivation to actually go out to work, not because of the core payment, but as you said in your comments, Chairman, the additional benefits that are critically important for people, such as medical cards and those type of services and important supports. So what I would like to see is moving away from a budget process where we give a €5 across the board payment to everybody. Old age pensioners, contributory pensioners, even if the contributory pensioners have alternative sources of income and other pensions, that we should move away from that type of model and actually front load areas where the need is most. And one particular area where the need is most, Chairman, is for people with disabilities, to ensure that they hold on to core benefits when they go into employment, that suddenly they have a job that they've worked hard for and they lose a whole raft of benefits. That is not, if you like, a progressive employment policy. And I think that the thinking in social protection has to move away from across-the-board payments, whether that's in childcare, in child benefit, in pensions, full stop. And it needs to be front-loaded to try and get people out of welfare who are well capable of getting out of welfare, but are terrified at the prospect of losing key benefits as they would see them, particularly medical cards. Just in terms of the budget submission from the National Council for the Blind, they had a very successful engagement across the road in Buswells about a month or 6 weeks ago, probably more at this stage, where a lot of members actually attended. Because, you know, the level of unemployment with people who are vision impairment and who are visually impaired and blind is totally unacceptable in this country. And, you know, the advocacy work that Chris and his colleagues, Kevin Kelly and others, are doing to try and address that is particularly impressive. And I would appeal to you, Chairman, and other members of the Oireachtas to become more engaged with the work that the National Council for the Blind are doing. Because I'm on the board, I see it at close hand, it is starting to make a difference. And with some extra supports at government level and at political level, I think a huge amount could be achieved. So again, thanks for the opportunity to speak, Chairman. Apologies, I was late, and I just think that this initiative from your committee is very worthwhile.
Thank you, Senator Conway. Mr. White, Mr. Reid, do you want to comment?
I will agree completely with what Senator Conway just mentioned. That has been a fear that I've had ever since the opportunity to go into employment has been there, that I would lose my medical card benefit, my free travel benefit, anything like that. It's just, that's a constant fear in the back of my head. It's like, how much am I going to be in deficit of what I already have now? Because while I am going to go up in how much I will be earning, how much am I going to go down in the cost of travel, the cost of medical insurance? I am a permanently disabled person. How much am I going to be charged for medical insurance? Because I need to pay for this kind of thing. My medical card will go away eventually, won't it? But I don't know.
Just to say, Mr. Reid, Senator Higgins alluded to the fact a number of months ago this committee sat with two other committees jointly looking at, I suppose, the difficulties of people with a range of disabilities accessing, and not just accessing, remaining in the workforce, why people were getting jobs, and that whole area of, you know, loss of supports and benefits. And as you rightly said, Mr. Reid, you know, just because you get a job, the disability, whatever that might be, has remained. And we were quite clear in that those supports need to be maintained in employment as they were in unemployment prior to it. And we made that point very specifically. Yeah. Mr. White?
I think Darren's very able to express the fears that people with sight loss have. I think, many thanks to Senator Conway, the sight loss community is a very large community, but it's been very much overlooked or taken for granted, not in any deliberate or manner, but it's something that we are conscious of, and the fact that sight loss is a growing area and people with sight loss can make a huge contribution. We're looking at massive inward investment from the likes of Google and Facebook. We're looking at massive inward investment from other European and US multinationals. They are always on the hunt for talent. They talk about talent attraction, they talk about talent retention, they talk about the lack of talent in Ireland, and yet we have this pool of talent. We have this outstanding pool of talent that, if it's enabled, if it's supported, if it's understood, can make a significant difference. It can make a contribution to the quality of life that people with sight loss have and other disabilities. It can make a contribution to their families, it can make a contribution to the workplace balance, and it can make a massive contribution to the work that's being done here. And we have an opportunity in Ireland to actually stand out. We have an opportunity in Ireland to be really front and centre of how disability and sight loss should be dealt with by employers. And we should be pushing the IDA about making sure that all the companies that they are supporting with government money should have targets around employment for disability. And we should make sure that they're upheld And we should make sure that when $6 billion goes into Intel in leak slip, that some of that results in employment for people with sight loss, employment for people with MS, employment for people with other disabilities, because it is a fantastic opportunity to make a difference around how we do work in this country.
Thank you. Senator Higgins.
So, no, thank you. I think you put it very strongly in terms of the large companies coming in, that this could be one of the conditionals attached. I just want to ask just a really specific question, because as we pursue our follow-up in relation to the issue around workplace adaptation grants, so as well as the increase in the budget in workplace adaptation grants, is there a difference to be made potentially in policy whereby if somebody is able to say, I hold a provisionally have been approved for a workplace adaptation grant, or a company has been provisionally approved for a workplace adaptation grant, that the paperwork is almost front-loaded, so that that becomes something that both the companies hold and maybe individuals hold as the recruitment process is underway, so that a company can say, we've already gone through the paperwork that would be implied if we happen to employ a person who has a disability or who has sight loss or whatever it might be. And similarly, that a person would be able to go to 2 or 3 different employers and know that this is something. So that was just a policy shift. I wonder would that, as well as the increase in budget is definitely needed. And then my last little question was we've got to touch on it, but macular degeneration and the issue of kind of medication in relation to that, is that something that's you're getting progress on in relation to this budget too, in terms of the exclusion of that from, the increased high VAT rate that was attached to macular degeneration supplements?
Yep.
Senator, Mr. White.
Chair, the 2 point, I think that's a really good idea, actually. That sort of people actually getting a tranche, corporates getting a tranche of funding allocated them, that they have to prove that they actually have the people, but certainly being pre-approved for certain numbers of workplace adaptation grants is a good idea. I think the idea, certainly in the health service, is personalised budgeting is coming down the line, that the money follows the person, and the allocation of workplace adaptation grant to, say, Darren, and whether he works in the civil service in the Gardaí or whether he works in Intel and leak slip, the allocation is to him as an individual, actually has a lot of merit in it. So, Senator, I fully endorse that view, and it's something actually we might take away. We were supposed to be educating you.
You're telling
But I certainly take that as a really good idea. The issue of VAT onto supplements for macular degeneration, there's been a moratorium on that and pushed back, so I think that has been addressed. So we're delighted that that's not been put as a barrier or an additional cost to people trying to prevent.
You're satisfied with that?
Yeah, no, we're happy with that.
Thank you.
Dr. Keating, have you any final comments you'd like to make?
Yeah, the point Senator Conway made in terms of how we determine how social welfare increases are implemented is a really important one, and something that we have been advocating for is that it's grounded in evidence, and that evidence base is provided by the Vincentian Partnership for Social Justice. That minimum essential standard of living is used by the Irish Insolvency Service to determine living costs, so it's stood the test of the courts. It's accepted by the Department of Social Protection in that the QCI for older children was increased last year based on that research. So it not only provides where the needs are greatest, but it also provides that whole of government framework, because you can see where costs need to be reduced. So, for example, if primary and secondary school was genuinely free, the cost of the QCI doesn't need to be increased as much if you have the cost of living reduced as well. So it's a really important framework. There's a challenge there in terms of the cost of disability and how you determine that. The NCBI mentioned the work that was undertaken by the Vincentian Partnership to outline the additional costs faced by someone with a visual impairment, but the cost will differ based on the disability. So it is quite a broad-ranging piece of work that needs to be done, but a very important piece of work that needs to be done. And in terms of that transition to employment, in our research that we conducted last year, fear of loss of the medical card came up increasingly. There's a campaign to be done around people understanding what benefits they can retain if they do take up employment, but as Darren pointed out, that cliff, that 3-year cliff, that uncertainty around what happens there. And I suppose it's important to state that the thresholds for the medical card have not increased since 2005. So they're still well below all social welfare rates. So that's something that needs to look at. But obviously, the overarching goal is universal healthcare so that there is no means testing and that it's just available to everybody based on need, not based on income. I'd just like to talk a little bit about Brexit, because we're really concerned about the impact that will have on the people we're assisting. We know that if there's a no-deal Brexit, we're going to see an increase in food and energy prices, and that will disproportionately hit people on low incomes. So in terms of budget choices, it's really important that those on the lowest incomes are safeguarded. We don't want a repeat of the previous recession where those on the lowest income, particularly low-income women, took the hit for austerity and the last recession. And in the forthcoming National Action Plan for Social Inclusion, we need to be ambitious around that and ensure that there's safeguards in place if we're faced with another recession.
Thank you, Dr. Keelty. Before we conclude, Deputy Boyd Barrett.
Apologies, Chair, and to the contributors. I'm not a member of this committee, and we're trying to buy and try locate today various things. But and I will look at your submissions. I have the documents, but I just have a very particular question. I wanted to take the opportunity to ask the NCBI. You may have seen some of the parliamentary questions I've been submitting about the situation in Dunleary, and I'm hoping Chris could shed some light on it. Since certain staff members were removed from the office in Dunleary, and there was a possibility at one stage that the office would be closed altogether, the service users were very, very distressed by that. But despite assurances that the services wouldn't be adversely impacted in Dunleary, the service users are adamant that they have been. And that the drop-in service in particular that used to be available there is effectively gone. And phone calls to the office are now being answered in Dundalk. And many of the just small but important services that were available before the staff member was removed are just not there anymore, and they're extremely worried about that, and aren't terribly happy, frankly, with the responses they've got from the HSE or the NCBI. And so I'd like to ask about that, and whether those full range of services can be restored. And the other thing they asked was about membership for service users of the company, of the group company. They feel that services should be service user led, or at least heavily influenced by service users, and that seems to me a very reasonable proposition. They point out that in the Irish Wheelchair Association you do have membership of service users of the group company, and they see no reason why that couldn't and shouldn't be the case in the NCBI. And very finally, the expenditure of the money on the Tala, the new Tala headquarters. I mean, I don't know all the merits and demerits of it, but there is a feeling among the service users in Dunleary that the expenditure on that is really what has cost the full range of services has impacted adversely on the services in Dunleary. So I'd like to hear maybe some responses and comments on that.
Thank you, Deputy Barrett. Just before I ask for a response and conclude the meeting, just to point out, Deputy Barrett, the witnesses were invited here in relation to pre-budget submissions. Whether they have the detail of the answer of the question you've asked, I've shown a degree of latitude to allow you to ask.
Thank you, Chair, and I appreciate that.
And if they're in a position to address it, well.
Mr. Chairman, while I completely understand why Deputy Barrett wants to put that on the record, I don't see how it's relevant to this committee at this moment in time.
Senator
Not telling
Conway,
you how to do your business.
Senator Conway, I've made the point that it isn't relevant to the proceedings, that this committee, the witnesses were invited here today to deal with pre-budget submissions, and in that regard, Deputy Barrett, I afforded him an opportunity with a degree of latitude to put a point. If the witnesses are in a position to respond, they may do so, and if they're not, so be it. But I didn't.
No, that's fair enough,
so,
Chair.
Mr. White, it's your option. It's completely whether you want to respond here or you want to correspond with either the committee or with the deputies.
No, thank you.
Completely up to you, Mr.
No,
White.
I'm happy to respond. These are issues that are difficult and not easy to come back to keeping everybody happy about everything. We have made commitments. We have an office in Dunleary, which we were planning to merge with a new office in Tala. The office in Dunleary gets €104,000 a year from CHO6. The cost of running the CHO6 service is €420,000 a year. We, as an organisation, we struggle. We only get about 70% funding from the state to actually provide all the services that we provide. The rest of the money we raise ourselves. So we, as would be expected on a value for money basis, have to do the best we can for the money that we have. The service that we offered in Dún Laoghaire was proposed to move following discussions and demonstrations with a small group of service users. We decided and agreed to keep the office open. The office is remaining open 5 days a week. People are still dropping in. The drop-in service that was referred to by Mr. Boyd Barrett is not officially there. It was never really officially there in the first place. We don't operate that service in any of our other 34 offices around the country. But what we're seeing now in Dún Laoghaire, and we've spoken to the little active group that's in Dún Laoghaire, we're seeing more people use our service in Dún Laoghaire. We're seeing more services being delivered from our office in Dún Laoghaire. We're seeing the quality of the service that we deliver from Dún Laoghaire improving. So we're offering more services to more people at a higher quality. And we have evidence to back that up. In terms of the Talacross move, we were originally in Clondalkin, which, as we spoke to earlier to Senator Higgins, was completely inaccessible to our service group, has very poor transport links. We moved our office at our own expense with no government support from anybody to Talacross. Our office is now literally beside the Lewis, beside the Telebus hub, and has given greater access to greater numbers of people throughout South Dublin. We fully take on board that it's not the easiest place to get to from Dún Laoghaire, but of the 2,000 people or so that would be availing of our service in that area, a small number of them live in the Dún Laoghaire area. And that's not to say that they don't want to access it. So the office on Dún Laoghaire remains open. The services, from our perspective, is improved, and we have actually added capacity and service quality by bringing up the service in Dún Laoghaire and offering the service in Talacross. In terms of being a membership organisation, I think there are something like 2,500 Section 39 agencies, and there are something like 10,000 charities registered with the Charity Authority. A minuscule number of those would have open membership, the IWA being one. The thing about open membership is it sounds great, but it's not really representative of actually the need to actually listen to people and what they want, because what it ends up is a big set-piece AGM, effectively, which will be in Dublin, and you'll get people along who want to be in Dublin, but it doesn't allow people in Tralee or Galway or Letterkenny or Athlone to actually engage in the organisation. So what we've actually committed to doing is actually launching an advocacy engagement strategy, which actually is looking to create panels so that I and members of the board will engage with locally, and that then feeds back up nationally into a service user representative panel. So we're actually looking more actively for people's views, voices about what the service should and shouldn't be. We are going out of our way and investing in enabling people to actually express their views, and we're actually looking to actually implement what they think NCBI should and shouldn't be doing. So I fully understand the views that the group in Dún Laoghaire are making. I've met with them on several occasions, corresponded with them as well. I know where they're coming from. If I had unlimited funds, I would be happily having a Dún Laoghaire service in every part of the country. But fundamentally, I don't have those funds. I don't have the funds to run the service that I want even today. We're one of the biggest organisations that's most underfunded. We've had a 16% cut in funding since 2010, like many organisations. So I feel their frustration, but we are doing a whole range of things to mitigate it. But fundamentally, the office is open 5 days a week, 9 to 5. It is open to provide services, and it's doing that.
Thank you very much, Mr. White. That brings our meeting to a conclusion. I'd like to thank our witnesses, Dr. Keelty, Mr. White, Mr. Reid, both for the opening statements and your informative replies to the matters raised. Our committee stands adjourned until 10 a.m. on Thursday, the 10th of October. Thank you very much.